For this lecture, we are interested in comparing different healthcare providers in how they treat patients for the obstetrical process. As you can see by the filter that has been activated here, we are already filtering our process for obstetrical processes only, because we are filtering on an activity that is related to the antepartum monitoring of a fetus. So we know for sure that whatever process we see probably has something to do with obstetrical care. Let's use the filter application now to filter on the healthcare provider. I click on this filter button. I click on attribute selection. And I seek out provider name. I'll start with the Baptist Health and Medical Center. I confirm my selection. And as you see, the process map has automatically rearranged to fit the process of this particular healthcare provider. Now, the interesting thing of such a comparison is that we can compare different healthcare providers and see what the similarities and differences are between these. This can give way to all kinds of research questions related to, for example, therapy adherence, but also fraud detection. If we zoom in on this particular provider, we can see that there is quite a long delay of about 3 months between a consultation and this particular ultrasound monitoring of fetus. We can also see that between the follow-up obstetrical consultation and the ultrasound, there is a delay of 51 days. Let's check out a different provider. I click on provider name. I deselect this one. And I click on this provider. And I click on done. A remarkable feature of this provider appears to be that this provider is using 2 different types of ultrasound procedures during the process of obstetrical care. Let's check this out. Here we have the diagnostic ultrasound procedure for stomach organs. And a few months later, we see a different ultrasound, namely the one that has to do with obstetrical care. So this finding here might be worthwhile to look at in more detail. For example, the healthcare provider might be committing some type of fraud by, let's say, using 2 different codes instead of 1 code. This somewhat deviant process might give rise to new research questions. We may want to exclude whether or not this healthcare provider is abusing the system by using 2 different invoicing codes rather than 1. For example, maybe this invoice code has a higher tariff than this one, meaning that the healthcare provider might be committing a type of fraud, also known as upcoding. It may also, for example, be a problem that has nothing to do with fraud, but instead has something to do with quality of care. The purpose of this example is to show that by applying process mining and by filtering on the different healthcare providers, we may get new and additional insights that are not available by using conventional statistic and machine learning tools. Thanks for watching.